Hello, my name is Mariana and I'm going to talk about cocaine. It can be found as powder or in a more crystalline form. But what is it? Well, cocaine is a powerfully addictive stimulant drug made of leaves of the coca plant from South America. This means that it increases the activity of the central nervous system. It induces alertness, elevates mood, increases speech, and decreases appetite. And it is addictive since it can lead to the development of tolerance and physical dependence. Its methods of use are injection, inhalation, oral ingestion, or insufflation or snorting. Cocaine can be used for medical purposes like anesthesia or as a street drug. Some of the effects of cocaine are anxiety, paranoia, seizures, coma, disturbed sleep, decreased appetite, malnutrition, severe weight loss, or it can even lead to a heart disease. These are just a few consequences, but taking drugs does not only affect you, it also affects the people around you. Since cocaine can change behavior, the aggressiveness, impulsiveness, and loss of self-control can lead to the loss of friends and loss of support from family members. Also, these characteristics could cause accidents and injuries on people who don't know you at all.
What is marijuana? Marijuana is a yellowish-green mixture of flowers, leaves, and crushed stems of the cannabis plant. The immediate effects of smoking marijuana include tachycardia, disorientation, lack of physical coordination, often followed by depression or drowsiness. Currently, there are no drugs available to treat marijuana use, but research is being done in this field. However, there are different therapies. One of them is a conceptual cognitive therapy, which is a type of psychotherapy that teaches people strategies to identify and correct problematic behaviors in order to improve personal control. What is methamphetamine? Methamphetamine is a powerful psychostimulant. It is a synthetic adrenergic agonist agent structurally related to the epiderm alkaloid and hormone adrenaline. In addition to methamphetamine addiction, chronic abuses or the drug demonstrate symptoms that may include anxiety, confusion, insomnia, emotional disturbances, and violent behavior. How to treat meth addiction? Nowadays, the most effective treatments against methamphetamine addiction are behavioral therapies such as inventions in cognitive behavior and contingency management.
Originally, cocaine was introduced into the United States as a prescription medicine. In the 80s, it became a surgical anesthetic, and today the powdered form of cocaine is still occasionally used as a local anesthetic in ear, nose, and throat surgeries. Cocaine began to rise in popularity again in the 60s and became a club drug often taken in discos. It reached its height of popularity in the 80s and was notoriously abused by high-powered, high-street Wall Street stockbrokers. Today, the notorious white power appears to be returning as a substance of abuse among many socioeconomic groups. The characteristics of cocaine, also known as coke, is a strong stimulant most used as a recreational drug, so it is commonly snorted, inhalated as a smoke, or dissolved and injected into a vein. Mental effect may include loss of contact with reality, an intense feeling of happiness or agitation. Physical symptoms may include a fast heart rate, sweating, and large pupils. Former cocaine users are at high risk of relapse. Even following long periods of abstinence, research indicates that during periods of abstinence, the memory of the cocaine experience or exposure to cases associated with the drug use can trigger strong craving, can lead to relapse. If you think that drugs won't affect your relationship with your friends, think again. At first, your friends might not be bothered by your drug use, although they may not want to use them. After a while, though, that may change. they may want to do other things while you want to use drugs, and they might not enjoy your company while you're high, and there you're not. Also, they may not want to associate with someone who uses drugs or hang out with a group of people who use drugs. When you're high or getting high, you won't be able to do things with your friends like gaming, sports, going to movies, skateboarding, or just hanging out. Instead of spending the time with you, your friends will choose to be with people who like to do other things. Pretty soon you will be spending more time alone or with other people who use drugs. They're not the ones um, that you mind being around. They don't pass judgment, and besides, now you have more in common with them and than with your old friends. They understand you better. You may even start lying, stealing, of to pay for your drug use. No one wants to be around someone like that. So consuming drugs are the consequences more dangerous that you will uh do.
Hi, my name is Monica, and I'm going to talk about the LSD drug. LSD is a mind altering drug. It is thought LSD causes its characteristic hallucinogenic effects via interaction with the serotonin receptors in the brain. Serotonin is a neurotransmitter that helps control your behavior and mood, governs your senses, and moderates your thoughts. The physical effects of LSD are unpredictable from person to person, and no one knows if they will have a good or bad trip. Usually, the first effects of the drug when taken by the mouth are felt like 30 or 45 minutes later after taking it. Uh, it peaked 2 or 4 hours and may last 12 hours or longer. Use by the intravenous route will produce a much quicker action, usually within 10 minutes, around 10-15 minutes. The effects include hallucinations, distorted visual perception of shapes, colors, altered sounds, anxiety and depression, flashbacks uh, before of days or weeks before, and rapid heart rate, and high blood pressure, dilated pupils, etc. They must have extreme changes in mood can occur if taken in large enough doses. The drug produces delusions and visual hallucinations. Overdose can lead to severe psychosis. It can cause a lot of mental diseases because it alters the mental behavior. They have in the physical effects we can also include nausea, loss of appetite, increased blood sugar, difficulty to sleep, insomnia, dry mouth, tremors, and seizures. LSD is produced in crystalline form and then mixed with other inactive ingredients or diluted as a liquid production in ingestible forms.
Alcohol. Alcohol is a sedative, hypnotic drug. At high amounts, it acts as a depressant of the central nervous system, and on low amounts, it is a stimulant. Some main characteristics of alcohol are loss of control and motivation, compulsive preoccupation, behavioral problems as family violence, drug dependence. The effects of alcohol in the body are higher blood pressure, skin bruising, muscle weakness, loss of memory, respiratory depression, lack of pupillary response to light, balance problems, incontinence of hearing, amnesia during the intoxication, stomach and intestinal ulcers, among others. Some abstinence effects of alcohol are: prevents the progress of liver problems, memory will be more strong, hydration of the skin will be recovered, lose weight, immune system will respond better, you become an active person. Some individual and social consequences of taking drugs are: low exam performances and missing classes. Drink drivers are a social problem, involving crime, development of diseases, family conflicts, economical problems, negative impact on children, and losing friends.